now we are going to hear from a panel of medical health professionals, sorry, not medical, health professionals. So I'm going to introduce the amazing Sally Dymond, who is a representative on the Medical Professional Board of ASEA and the Australian representative, and a phenomenal leader in her own right, a double diamond. Please put your hands together for the amazing Sally Dymond!
How is everybody? Yeah! Have a bit of a dance, have some fun. Oh, I even get a chair. I like to see. Oh. Okay, so I'm going to introduce my panellists here. We have Lorna Golombek. Lorna is a dear friend of mine. She's a physiotherapist and extraordinaire in all things physio, Pilates, lymphedema management and oncology rehabilitation. She loves learning, embraces gratitude wholeheartedly in her life as she inspires others to live their best life. Next we have Alyssa. Alyssa is, sorry I'm reading notes, founder and director of Family Time Australia, a paediatric transdisciplinary clinic. She is a paediatric occupational therapist from Adelaide. We have Dr. Ray Dixon. He has 40 years experience as a chiropractor and a naturopath. He has lectured in 3 places over 16 years, the Australian College of Natural Medicine, now called the Endeavour College of Natural Health, which is where I went actually. Victoria University and the Southern School of Natural Therapies. Dr. Ray, thanks for joining us. And of course we have Dr. Carl, and you all know who he is, an MD from Duke University, been in private practice since 1983, 12 provider practice with 70 staff. So thanks for joining us, and this is always one of the really great panels because we often get asked as therapists and medical people, you know, why isn't it being used in our practice, or it's really hard to engage your therapist into ASEA. And so maybe we'll start with a question on how, and I'll direct this to Alyssa. Alyssa, can you share with us how you heard about ASEA and Renew 28 and the redox technology? Oh, that's good.
Hello?
Yeah.
There you go.
I heard it from a very good friend of mine, everyone probably knows him in the room, Dan Doyle. And I heard of him and I heard the redox and I put it in the cupboard. So it sat there for about 3 years. Yes. Took me a while. I guess as a health practitioner you get told about lots of different products. Yes, everybody's the same. But then when I started doing some research, I realised that what I was researching was in my cupboard. So then I started taking it and I had a beautiful result myself.
Awesome, thank you, Alyssa. It's a very, very common thing for me to talk to therapists. Actually, I was just doing an event for someone recently and, you know, I was talking to someone, he had an issue with his shoulder, he started to use the gel and he turned around to his wife and he said, don't we have some of this in our cupboard? It was actually a friend of mine that was a therapist that had given them a tube many, many years ago. It had a blue lid on it, so that tells you how long ago it was. And he was like, you know, couldn't do more than this, and after like 3 applications he was doing this, and he was kind of looking at his wife saying, why the heck haven't we used this before? The answer most often is sometimes sitting right in front of our nose, and in a lot of cases the tube is actually in people's houses, they just don't really know how to use it. So health professionals are no different. Often we tend to give tubes to health practitioners without the information of how to use it. So maybe, who else have I got listed for that? Well, let's start with Ray. Can you tell us a little bit about how you heard ASEA?
Sure. I was introduced by Lorraine Bavard. Where are you, Lorraine? There's Lorraine. Lorraine was, it goes back a long way. We go back many years into my 20s, I think. We did karate together. I was her chiropractor. Helped her a little bit, I hope, along the way to being a world champion 5 times. Had to straighten her out a few times. I can certainly vouch for that. And Lorraine she told me that she wanted to introduce the technology to me. We had a great lunch. I've said this before to many, that practitioners, we have a lot of baggage. We have a lot of education. That education doesn't necessarily mean we're right up, as was pointed out earlier by Dr. Michael, with the very latest, and I'm a typical example of that as well. So I've got a great recollection of the lunch. I have no recollection of redox at all. And I remember thinking, thanks Lorraine, I'll see you later. And she was very wise in that I would still be treating her from time to time. She didn't mention it, but I used to talk to her sisters and her family because I treated them too. And I used to say, how's the ring going? The business. That was just a little aside. Then, long story short, I retired from practice, kind of retired, I'm backing again, but I left Melbourne to live in Phuket, which is where I live now. It's why you'll see the Thailand ASEAN flag here, a little bit for Thailand. So I married and moved to live in Phuket. Lorraine and I also used to do karate together. And so she came, who was always a friend, came for a holiday. Now I have the opportunity and the time to pay attention. Now, this is all about the timing. So, because I had the time, and she was there about 10 days, I started to look. I thought, oh, let's be polite. So I started to look at it, and I started to look at the stories and the testimonials. I did not believe them. I still find it hard to believe, but I've seen it all now. So I'm thinking, wow, this is extraordinary. Because I'm seeing all my failures, by the way. That's what I'm seeing. As physicians, you're always like, how? And I'm seeing people responding to treatments, this redox, that I could never help. And I was a herbal medicine practitioner, homeopathy, nutrition, the whole gig from the naturopathic side of life. And I was just astounded. And my final conclusion was, look, if this does 50% of what I'm reading, I'm in, because it would still be a remarkable product. And that's when I started. And that's 18 months ago.
Fantastic, thank you so much. So, Dr. McLeod, can you tell us how would you introduce ASEA products into your into other health practices, or how would you speak to other medical professionals maybe in the US? Might be different to how you might speak to them in Australia.
Okay. Well, it's again, I think as we pointed out, medical practitioners, doctors particularly, lots of pride. You've got to have them at a point where they're at least open, and that's hard. That is very, very difficult, especially when you're dealing with something that is outside the natural. What their training is bad. I mean, let's face it. We're trained. We go through years of this training, and you've got to bridge that gap. You know, for a doctor to admit that they don't know everything is a big deal. I mean, at least the MD degree, some people think it stands for mighty deity, but we aren't. And so I think that's something to basically overcome. And I think there's a Pinehurst event, and I've actually talked to the people organizing it, that I'm going to attempt to entice some medical people to go to that, because there's a golf event. And, so some of them like to golf, so I think I can get them to that. But to just present this as it's an option. It's an option. Because I think we do want to help. All of us in the medical community want to help. But it's sometimes you just don't have all the tools set. And for somebody that's closed to anything other than a prescription, this opens that box a little bit. The lid is opened up. And if you can get somebody who at least is willing to listen to that, then I think we can take some of the studies and the research, and I mean, you know, I would challenge them. If you don't believe my product, just go and look at the redox biochemistry. Go to Google Scholar, right, folks? Google Scholar, and just have them type it in. Whatever field they're interested in, and they'll see that the biochemistry is screaming. It's screaming. We don't have all the details. We haven't done all the studies yet. But it's literally screaming at us now. And folks, we have an answer. I think it's the only answer right now. It's the best answer. And this company is forging ahead. You're with a company that's going to forge ahead in this area. Sorry, I'm doing a little sales pitch.
Perfect.
That-
I was actually at
I think that's what you have to do with medical people.
Yeah, I agree. I was at a conference actually, and someone gave me some really good advice. They said when you're speaking to a medical practitioner, the first thing you should always do is be in awe of how much they've studied. So say to them something like, I'm in awe of how much you know and how much you study and how much time you've spent learning everything that you know. But I think there's something that you don't know about that I know a little bit more about. Would you be open to me sharing it with them? So you stroke their ego and then, you know. So I really liked it and it has worked for me. So you can all maybe try that. Okay, so Lorna, let's ask you. They say in a seer you get paid in goosebumps. What would you say has been your light bulb moment where you really caught the vision and saw the power of what a seer can do?
So I won't go into the introduction of how I used Renew 28 and Seer in my collective step, but when I was sent through these questions, I thought, I don't really know what my goosebump moment was. There have been many goosebump moments, but then the one standout for me was in using Renew 28 with my patients and chatting to them about the different things that it can do and the questions that come up around, well, can it help this and can it help that? And the standard answer is, if it involves a cell, use the gel. That's an easy one to remember. And so gradually some of my patients got educated, some of them were friends of friends. So one of my clients who shared with another one of my clients, because they were close friends, then went on a skiing trip to Japan, got in a conversation with a couple in New South Wales that had been battling to fall pregnant, and they decided to start using the products. And basically, in terms of enhancing their cellular health, they now have a baby. And so for me, that was just a light bulb moment in terms of not just the power of the product, but the power of networking, and to put my misconceptions around the network marketing business to rest in terms of seeing the good that it can do instead of all the other stories that can come to you.
Awesome. Thank you, Alyssa.
Had lots of goosebumps since discovering the science of redox. So in our therapy clinic, we have lots of different disciplines. And so we're really big about looking at a child holistically and looking at their whole family and constantly researching about what else can we do to add holistic practice and help these children to reach their full potential. And when I found redox, I realised we had the biggest missing piece of our puzzle. And I think now that we can start to see it and see the benefits of what it's doing to all of us and to our health, for me the goosebump moment was we found the missing corner piece.
Question?
Yep.
Again, many. The initial ones were the stories that I was reading, because the goosebumps was more excitement. If this is half true, this is something special. Since then, I mean, the latest goosebump moments this weekend. Seeing where the company's going and the research they're putting in, and I started to call this very early the Holy Grail, because healers, practitioners are always looking for that something special that's going to help people relieve suffering of any kind. And I've never found anything in my life that is as powerful an aid to healing. I remind you, the body does the healing, but as an aid to healing, by taking it as a supplement, having worked with thousands of them, I've never seen anything like this. And so I'm constantly experiencing goosebumps.
I think I shared my goosebumps this morning. It's all the folks I've seen have lives that are changed in positive ways. It's things that can't be measured, it can't be measured. It's kind of off the scale. It's very emotional. My family, patients, people that I haven't even met, but I hear the stories. That's goosebumps. That's goosebumps. And then you hear the other side. Fair and balanced. hear the financial story. I mean, you know, I'm blessed where I am financially, but you know, there's those stories as well, and they're just as powerful. They really are.
So Alyssa, we'll go back to the other question about introducing ASEA products to another health practitioner or therapist here in Australia. How would you and Lorna maybe take that?
Yeah, that's a tricky one. Who's tried to approach a health practitioner? How'd it go? Good, probably in the cupboard like me, three. I think it's a really challenging question, and I know that as a health practitioner we have ruled here by some quite strict rules here with our medical board. And so if I had a client or a patient that came to me to talk to me about ASEA or the power of a redox molecule, I actually probably wouldn't listen. And part of that is partially some of our ethical rules about our client relationship, our patient relationships. So I think the best way to approach it is through people that you know. So if you have a friend or a family member that is a health practitioner, do it from a relational point of view. So for me, it was Dan, a really close friend of mine, who was trying to convince me that I didn't know everything. And, you know, so I think it's really important to go from that place of relationship when you're talking to a health practitioner.
Well said, Alyssa. And I think also, so as fellow health professionals, we tend to listen to other health professionals, so we will open up our ears. So again, if you will have somebody in your upline, or there's, you know, plenty of cross-line people who are therapists, introduce a therapist to another therapist in terms of backing up, giving you some backup. You heard earlier with Dr. Michael how they got Dr. Dick Walker on the line with him. It's really important because we will have detailed questions that you won't have the answers for. So, and also being aware that you need to give, there are people who just jump on straight away, and there's others that need to go down the rabbit hole. It's almost the more education we have in the health field, the harder it is for us to wrap our head around what's going on. My introduction was through Sally, and because of the biofeedback technology that we use with treating patients, it was just kind of joining the dots in terms of this is a take-home product that patients can use to continue their care. But the other thing I also think is just to remember that your health practitioners that you may be sharing with, exactly as Tyler shared yesterday, they are people too, and it's actually looking to what their personal need is before they even consider their clients or their patients. Look into their personal lives. They often say that, you know, people don't care how much you know until they know how much you care. I think that applies just as much to health practitioners.
So I was just at lunch actually with a couple of lovely people out there in the crowd, and we were talking about a doctor who they know and are working with in the profession that he's in, and he was telling me how sick this doctor is, and you know, there's so many doctors out there that are actually really sick themselves, and one of the highest rates of suicide is actually doctors. I don't know if it's like that in the US, but I certainly know that is how it is here in Australia. And if we can help our doctors, actually wouldn't that be an amazing way for them to be able to help their patients? Because without us being in a really good place, we can't actually help and treat our patients. I had someone come to me today who's a therapist as well, and she said she's about to drop all of her balls because she's about to go and bury her head in the sand because there's so many people around that she wants to help. And I just gave her the same advice I gave you all yesterday, and it's we need to take care of ourselves first, put the oxygen on us first, and then we can help each other. And really, for the doctors, they're really, really struggling. You don't really see it in your appointments. You get 7 minutes with a doctor and they're there to really serve you, but just know that there's many, many doctors out there suffering, and they're the ones taking a lot of pills, actually. When you talk to nurses and doctors, friends of ours are, you know, nurses, and their first port of call is their drug cabinet. You know, they're sometimes a bit closed, so it's how do you break into that barrier of educating them on natural health. So it mightn't really be about redox first, it might be a few other things that starts to soften the load to try and help them out. Okay, so what have we got here? Once you've added ASEA's redox products to your existing treatment programs, what changes in the results have you observed in your practice?
So many. I guess because we started with Renew 28, and as a physio, obviously I'm dealing with a lot of aches and pains. I'm also dealing with people recovering from pretty traumatic treatments, from surgeries and radiotherapy and chemotherapy. And so actually using the Renew 28 to help their skin recover from some of these treatments, and to also help them in terms of improving their discomfort that they have. It's something as simple. Often when people come in, you don't know where to start with them because they're sore here, they've got this going on, they've got that going on. And you can't address everything on one appointment, but this is a way that I can actually put some gel on and carry on working somewhere else and then check in with them how that feels at the end of the treatment session. So that's sort of how I've sort of used it, and then that obviously has a knock-on effect in terms of them actually having an option to take some home with them that they can then continue to help improve things so that we can move forwards faster and get into their rehabilitation phase as opposed to working on all the discomfort and restrictions that they have. So in particular, people who've had breast surgery, the massive scar tissue that has resulted from that, and sort of the ASEA studies in terms of the blood flow to the area, so 49% more blood flow within 15 minutes was a big sort of part that I looked at, and the improvement in skin elasticity. So that's another massive thing that we deal with. And great analogy that I've had that I use with my patients is that scar tissue is, instead of being a floppy piece of bread, it's like a piece of toast. So it does not move. And so when people are trying to get range out of their shoulders, the tissue across the chest wall can be glued down and won't move and glide and slide. And we can give them stretches to work on, but obviously if we can work on them being able to improve the elasticity of that connective tissue, combined with their stretches and exercises, we can get them far further along the track. And it's interesting because another therapist that I work with, she worked in the public health system, and when she worked with me in my clinic, she said the results that we get, she says she's never seen those in the public health system. So, just actually being able to make a difference to someone and for me, it's just become the norm. Why would we expect not to be able to restore somebody's range of motion? So giving them the power in their hands, but they don't always have to keep coming back to see me as well. It's been a big one. So I don't want to see people for the rest of their lives.
On that note, I know you have a really great testimonial on a breast surgery that did occur.
Yes.
Maybe you could share that, because I know many of you out there know someone who's had breast surgery, either related to an enhancement or some rogue cells, and one of the greatest things you can ever gift that person instead of flowers or a meal is a tube of Renew. There's just one tube of Renew for that person going through that kind of surgery or treatment will be absolutely life-changing if they use it right and they use the entire tube in a week or just over a week. Get as much as you can onto that area. So Lorna, maybe you can share that story.
So this client had been through all the conventional treatments and then was having a reconstruction done, and they were doing what they call a lat dorsi reconstruction, where they actually take the muscle from the latissimus dorsi here, they sort of feed it round through a little side of the chest, and they use it to reconstruct your breast tissue. And normally because of the tightness of the scar over the chest wall, picture a long sheet of cling film that you then chopped a great big chunk out of and then try to glue the edges together and expect to have the same flexibility out of that area. So fairly often with that, they actually have to take a skin flap from the back as well to give them enough tissue over the front to allow them to actually do the reconstruction. And working with this client and using Renew 28 and our stretches and all the other things that I do, she was able to have a scarless lat dorsi reconstruction where they actually used just her existing scar. So for her, that was massive, because it means then if she wants to wear, tank tops, cutaway sleeves, whatever, she doesn't have a scar that's showing. So that was pretty massive, and her plastic surgeon was very blown away by that. So this is a great outcome.
Okay, so Dr. Dixon, maybe you can share with us how you added into your practice.
I thought about this question. Remember I said I was retiring? I actually came out of retirement because of redox. That's why I'm here. I retired. And when I knew, or first suspected, now I know, the power of redox, I thought this has to be shared. So I'm now part of Virtus's mission. And I'm loving it. I enjoy travelling. I'm travelling a lot, more than I've ever travelled in my life. And I'm presenting a lot. And that's great. So when I thought about the question, I still do have a little bit of a practice in Phuket, but I'm trying not to tell anyone, so please keep that secret. I have no signage. There's a little bit of an expat communication, word of mouth going on, but I'm trying to slow it down. But It's not slowing, but that's okay. So I see people there now, and when I thought about the question, I thought, well, people are people, and what are patients? Well, they're people. So I actually don't differentiate between patients and people. They're the same. So if I'm seeing a patient that is suffering, well, and I do a lot of musculoskeletal, being a chiropractor, I'm avoiding the naturopathic over there because I just use redox. So when they've got pain, I will say, look, if you want to get the results quicker, I'll quickly mention the story of redox, and just about everyone will take the redox. They'll take a Renu. Some will also take the drink, but most will take the Renu because it's so powerful musculoskeletal-wise to demonstrate the results and for them to experience the result. But I do exactly the same thing if I just meet someone on the street. If I'm talking to them and they mention their sore knee or whether it's whatever the cause of the inflammation or damage might be, or their back or neck or whatever, I just say, I've got a product that'll be really good for that. So I treat them exactly the same. I just offer solutions, and we've just got such a powerful solution that it's really easy to talk about.
I can't turn the microphone away. This has made me feel safer with patients because, again, it's an alternative. And as opposed to my colleague here, who spent lots of time researching and learning natural medicine. I mean, that's a different field. I mean, that's huge. So if I want to offer an alternative, I only have to learn about one. So it's a little bit self-serving, right? But when you have the one that does as much as it does, wherever you apply it, I've got a great story real quickly. It's a goosebump story. Okay. Patient, as I was just getting started at doing this, offering her, she was coming in for basically what she thought was a refill of a prescription that would help with acid conditions. And I looked at her and I knew a little bit about her story, and I said, I think I've got an alternative if you'd be willing to think of something besides the prescription. And of course she looked at me, and she's known me for years, and it was like, what have you been smoking, But she was open to it. I mean, I knew that she... Well, I asked her to start doing this. Now, she also had a very severe condition that affects the muscles and the soft tissues. What I didn't know is that week, she had been having therapists, both in our structure as a physical therapist and a deep massage therapist. She's using the gel and the drink for a week. And she had these appointments. They knew her like the back of their technical hands. I mean, it's amazing to me. I know my patients' labs and printouts, but you guys are amazing. I mean, again, amazing. They put their hands on her and said, what are you doing? It was one of those, what are you doing? And she looked and she didn't quite understand. And they said, I've known you for 2 or 3 years. They've been therapists. And I've never felt your muscles this relaxed. What are you doing? And then she realized, I just started doing this a week ago. And she said, well, wait a minute, maybe I'm mistaken. You have your deep massage tomorrow, don't you? Because they would do it that way. They'd stack them on. And let's see what she thinks. So she went in, didn't tell the therapist anything, just going through the routine. And almost immediately is, what are you doing, Barbara? And at this time, she knew. She knew what to say. She said, I'm doing this. She said, I've never been able to get one or two layers deep. I can get down deep. And again, it's beyond my training, but they knew. They knew by their patient. And so to me, it's like, oh my goodness, how can I not offer that? And it takes a lot of the burden actually off of me, because now I can be adept in both areas. And again, that's maybe an approach for your medical types, is you want to be adept in only one area.
I don't want to go into specifics, but I just want to talk generally about what I'm seeing, I guess, from a therapeutic point of view. And with therapists, we are probably the only practitioners that have a guess. So we look at symptoms and we look at our studies and we look at research, and as a whole team, you know, we have occupational therapists, speech pathologists, psychologists, psychosocial therapists, nutritional therapists, integrated GPs, etc. And we work really closely together for our families. And what I'm finding now is some of these treatments and these systems and things that interventions that we would use are not being as effective as they were 10, 15 years ago. And what's exciting and what is so amazing and gives me way many more goosebumps is that when we can add something that is going to help us at the cellular level, we actually can start to see our interventions being effective. Because we're actually working on the problem, and the problem is if we have anything wrong, anxiety or sensory processing disorder, etc., it all comes down to the fact that our cells are not at homeostasis. So for us to be able to get right down at that molecular level and actually give this back to our patients, we're starting to actually help them. So I'm really passionate about that.
I've got to the questions here. So, who hasn't answered the question when they added it to their treatment program? Did you answer that? We've all done it? Oh, that was okay, so without mentioning any medical disease names and maintaining a compliant testimonial, maybe tell us your favourite testimony that you've experienced with a patient that has been kind of life-changing for the family.
So mine is actually, I think, my very first patient that I shared redox with. This lady came to me with something that was open on her leg from lack of circulation. It had been like that for 7 months. She tried all sorts of things. She'd used saline irrigation, so there you go. Antibiotic creams, Manuka honey, colloidal silver, you name it. And when we looked at it, it was probably about 3 centimetres. And the skin around the edge was really not looking good at all. It was kind of a bluey-grey colour, which is never a good sign that there's much life happening there. And at the time, so she was in her 70s, and she was caring for her mum, who was in her 90s, who basically was in palliative care. And her mum was partially blind, partially deaf. She wanted to be by her mum's side. She did not need to be coming for therapy appointments to try and address what was going on, and doctor's appointments doing daily dressings and all this drama around it. So as a lymphedema therapist, we deal in circulatory issues, but I sort of thought about what I just learnt about the whole part about the circulation that I mentioned earlier. And I just said to her, look, you know, I've just come across this product. You know, it's meant to have this improvement in circulation. Would you like to try it? And I sort of said to her, you know, I'll need to check you after a week to see what's happening, and then we'll just sort of progress from there. So she started using the gel just twice a day whenever she changed dressings and things like that. And in a week, I took photos, and in a week she came back, and I could see that the skin around the edge was starting to change, which was pretty exciting. We took progressive photos. I didn't see her then again for probably about 4 weeks. So I got her to take photos in her bathroom, and so some of the photos I have got like her little plaid pyjamas as she was doing it. I used a tape measure as well, gave her a tape measure, and pretty much over 8 weeks that progressively closed over. So from being 7 months, 8 weeks it was closed over, 10 weeks, you could just see like the purple mark of where there was scar tissue sitting there. And that was just massive. To know that I didn't have to spend time taking her away from her family situation that she needed to be there for, and that this gel had actually done what the studies had said it could do was just mind-blowing for me. A continuation of the story, she continued using the gel for probably another 5-6 months, and then sort of thought, oh, things are doing okay, you know, I don't really need to use it anymore. And within probably about 6 weeks, the area started breaking down again. So I say that to illustrate that this is a supplement, it's not a cure. We are empowering our body to do what it's capable of doing, but we've all heard this before, as we're getting older, it's not doing such a good job. So we are just literally topping it up, and just like you put fuel in your car, fuel in your body to do the work that it needs to do, we need these molecules. And so that, I think, is a very clear illustration of the difference we can make for people, but also for them to know that there's certain processes for people that will settle and they won't need to use the gel anymore, but the older you are, the more likely you will need to continue using it, and knowing what we know, why wouldn't you? Just to prevent other things you don't know about.
Oh, look, I've had quite a few. Certainly one comes to mind in Phuket, actually. It's a 70-year-old retired lawyer from England. He had massive damage in his cervical spine with titanium plates around about 3 vertebral levels. But he still experienced a great deal of pain, and you can imagine he had a fair bit of restriction on his range of motion, his ability to turn his neck. But at the same time, he had a totally degenerated lower lumbar spine in the low back area, narrowing in on the spinal cord, we call that stenosis. So he had problems with his legs, pain, and he'd had this for some years, with minimal relief from all manner of treatments that he'd actually had. So, as a chiropractor, I'm certainly not going to be manipulating a titanium-plated cervical spine, I can assure you. So I thought, okay, well, what have I got here? And I went with Renault 28. So I had him using that because multiple areas, as you mentioned, patients don't usually come with one problem. The older we get, the more problems they come with. So he was actually using it all over his neck and his low back. And I was just stunned with him. I think he came back a week later and he was certainly improving, but after 2 weeks he said he never felt so good for years. So that one certainly stands out because of the amount of degeneration and deterioration that was there. We don't normally expect relief in those circumstances. It would, under all of the previous weapons that I had, it would be minimal. And he'd already experienced that. He'd already tried those things. So that was certainly one example.
Awesome, thank you.
Well, I've already mentioned some, but I'll mention them.
No one's tired of testimonies, are they?
This was a case where my daughter Anna, who had Gideon, okay, so the connection.
How's Gideon?
He's doing great. You know what? He runs, there's only one person who can beat him in races. His older brother, who's actually he could run in many colleges right now. He could get scholarships. So he's doing marvelous, marvelous. Thank you, guys. Anna had gotten through social media, and one of my places to grow, confession, is social media. So they had connected on social media because of maybe some similar medical challenges. And she said, Dad, would you do a three-way call with this person? Because I think they want to, but they just, I just need your help. And I said, sure. And I looked up where this person lived, and they lived about 3 hours, 4 hours from the annual convention. So I kept that in my head, and we're talking on the three-way call. And eventually I said, if you still have some questions, why don't you come to convention? It's only a 3-hour drive. This lady came to convention. She heard all the stories. She was ready to do this. Now, she was a former marathon runner and very much an athlete. At this point, it was a challenge for her to even come and sit and listen to the speakers. She started using the products, and different stories of how she was gradually starting to get back into things. The thing that was so exciting, ladies, was when she told Anna, Anna, it's so wonderful, I'm running and all that was great, but I can put on those high heels for my husband, because she couldn't wear anything but flats because the pain was so immense in her body. Putting the stress on that was incredible, and she was just thrilled that she could wear high heels. So, you know, it was big for that couple, and that made my heart sing.
Practitioner, allied health therapist, our main goal is to help people, and when you add redox into your practice, it amplifies everything you were ever taught and everything we know. So that's something I personally experienced, and now you've heard it from everyone from a physio to an occupational therapist to a speech therapist. Any modality of therapists can add redox into their practice, because we're all treating people, and people is the crux of what we're doing. So thank you for joining us this afternoon. It's been a pleasure to sit here with you, and for Dr. McCarl for travelling all the way from the States. Now he knows how it feels first when we come to America. It's a long way. The first thing he said to me is, I get it now. So thank you everyone for listening. Go out